Ayan. Okay, preparing to go live. All right, so we're already live. So good evening, everyone, and good evening to those joining us from the portal. No, my name is Dr. Laline Tiongson, and I will be the host of today's Zoom conference. So before we start, allow me to share a small prayer with everyone. Let us put ourselves in the presence of the Lord. Lord, true source of light and wisdom, lofty origin of all being, graciously let a ray of your brilliance penetrate into the darkness of my understanding, and take from me the double darkness in which I have been born, and obscurity of both sin and ignorance. Give me a sharp sense of understanding, a retentive memory, and the ability to grasp things correctly and fundamentally. Grant me the talent of being exact in my explanations and the ability to express myself with thoroughness and charm. Point out the beginning, direct its progress, and help in its completion. All this we ask in Jesus' name. Amen. Okay, a few reminders for everyone. I will be the host of this teleconference. Please have your audio on mute. You may unmute your audio to answer questions and, of course, to give feedback. Any video recording, screen shooting, or screen recording of the program is strictly prohibited. So, guys, please do not attempt. Please observe proper decorum at all times. And if you have a concern, you can message me through Viber. If it's urgent, you can call your Mother Goose through Viber. If you want to share suggestions, recommendations, feel free to message me through Viber. And of course, for your academic related concerns, please message Big Daddy Doc Brawley in his official Facebook account. And always wear that smile and be happy. All right, so today we have the Pharmacology Summary Lecture and Quiz Master. Today is August 16, Wednesday, and this will be from 7 to 9 p.m. This is a synchronous activity, meaning it will not be recorded and posted on the portal. But before that, before we start, let me call on Doc Brawley. Doc Brawley, have some announcements to make?
Okay, everyone, we're going to make this the standard format now of our summary lecture. So we're going to call yung synchronous sessions natin after each major subject as a summary lecture. So ang mangyayaring format will be yung summary lecture muna, okay, for about 1 hour to 1.5 hours. And then magbibigay ako ng clarifications and corrections sa handouts. Okay, yung mga commonly natatanong for the past 4 days, i-discuss ko. Corrections, if there are any, i-discuss ko din. Okay, if that's for about 20 or 30 minutes. And then the last 20 or 30 minutes will be for your quiz masters. So that's what we're going to do today. Okay, so Lala, introduce the speakers and then do the summary lec.
Okay, so for our speaker for today is Dr. Madeline Johanna L. Abraham. Doctora is top 6 of the Philippine Licensure March 2022. Okay, so pwede kayong magtanong. She is from the University of Santo Tomas, Faculty of Medicine and Surgery. She is also a dermatology resident in training. So, medyo busy talaga si Doc. Not only that, but she also has time for YouTube videos. Okay, so she's a content creator in YouTube. Alam ko marami sa atin nagpapangarap na maging content creator ng YouTube. I know my son parang yan yung sinasabi ng mga kids ngayon na parang, what do you want to be? I want to be a YouTuber. Diba? So they all want to be a YouTuber nowadays. Ayan. So, Doc,
Wag muna yan, yung na-lecture muna.
Okay, so let's just wait for Doc Abraham.
Dr. Abraham, by the way, for everyone, will be your teacher for the Pharma Pearls. So siya yung magbibigay ng parang final coaching natin near the board exams. Okay, she also was the one who conducted the live on-site sessions for Pharma for the past 3 days. Okay? Okay, wala pa si Doc Mads. Okay, sige. So, Sige, pasagutan mo na muna Lala
Yes,
yung
Doc.
ano
Kaya
natin.
sagutan muna natin 'to kasi medyo na-late lang ng konting-konti si Doktora. So, get out your pen and paper, guys. All right, because you're going to answer this simultaneously. All right? So, I will give you 40 to 55 seconds per question. So, let's try to do our best. Right, number 1. In a pregnant patient taking heparin, APTT is monitored. Toxicity would be subsequently treated with which drug and via what interaction? So is it A, vitamin K via physiologic antagonism, letter B, naloxone via pharmacologic antagonism, C, protamine sulfate via chemical antagonism, or D, activated charcoal via dispositional antagonism? So I'll give you 40 seconds to answer the question. Okay, last 20 seconds. All right, so hopefully, nasagutan nyo na siya. Next question. Number 2, true statements regarding disulfiram reactions except, is it letter A, an alcohol dehydrogenase inhibitor? Letter B, used for alcohol dependence. C, similar reactions may occur with cefoperazone or cefamandole. Or D, it is a CYP450 inhibitor. So which of the following? A, B, C, or D? Time starts now. Okay, 10 seconds. All right, next question. A 31-year-old female biology teacher went to different islands all over the Philippines to collect shells as souvenirs for her students. She then developed abdominal cramping, bloatedness, and saw blood in her stools. Examination of her stool showed presence of a small, inconspicuous spine on the egg. With your likely impression, what is the mechanism of action of the drug? What is the mechanism of action of the drug you will give? So is it A, increase membrane permeability to calcium, B, inhibits microtubule assembly, C, intensifies GABA-mediated transmission, or is it D, depolarizing neuromuscular blocker? So 40 seconds starts now. Okay, next question. Number 4. Some drugs for diabetes mellitus may cause a decrease in the patient's weight. Which of the following do not have this effect? Is it A. Metformin, B. Pioglitazone, C. Liraglutide, or D. Canagliflozin? So is it A, B, C, or D? For those of you that just joined, I will be giving the 10-item question and you will answer it at home, and then we will discuss them after. Last 20 seconds. All right, next question. Number 5. A 73-year-old man was brought for neurological evaluation by her brother because of a 3-year history of memory impairment and difficulty finding words. Which of the following is least likely indicated in this case? Is it A. Galantamine, letter B. Rivastigmine, C. Donepezil, or D. Biperitin? So which of the following? A, B, C, or D? 40 seconds starts now. All right, next question. Number 6. In patients diagnosed to have pseudomembranous colitis, we prescribe a locally available drug to be taken orally. This drug acts via which mechanism? Is it A. Reactive reduction by ferredoxine forming free radicals that disrupt electron transport chain? B. Disrupts protein synthesis by binding to the 50S subunit of bacteria? C. Binds to penicillin binding proteins in the bacterial cytoplasmic membrane, inhibiting transpeptidation reactions, or D. Interferes with bacterial DNA synthesis by inhibiting DNA gyrase. So your 40 seconds starts now. Okay, next question, number 7. Atorvastatin must be given daily to the following patients, except is it A. 55-year-old male with unstable angina, B. 48-year-old female with LDL levels at 195, C. 36-year-old male with ASCVD 10-year risk at 6.5, or D is a 69-year-old female with an LDL of 90 and diabetic since 7 years ago. So your 40 seconds starts now. For those of you just joining, kindly take note of your answers to these questions 1 to 10. They will be explained later by Dr. Mads Abraham. All right, next question, number 8. The chemotherapeutic drug vincristine, which is used for leukemias and lymphomas, acts on which particular phase of the cell cycle? So is it A, G0, G2, M, or S? A, B, C, or D? So vincristine acts on which particular phase of the cell cycle? All right, next question. Number 9, which of the following neuromuscular blockers undergo Hoffman elimination, yielding a seizure-causing substance? Is it A, pancuronium, B, succinylcholine, C, tubocurarine, tubocurarine, or D, atracurium? A, B, C, or D? 40 seconds starts now. Okay, and the last number, number 10, prostaglandins and its analogs are commonly utilized in both obstetrics and pediatrics. Identify the false statement. Is it A, Mobius sequence may occur as a result of in utero exposure to misoprostol? B, carboprost has a significant effect in controlling postpartum hemorrhage due to uterine atony. C, dinoprostone is a PGE2 analog, which is FDA approved for cervical ripening for the induction of labor. Or is it D, alprostadil is a synthetic prostaglandin commonly used for medical closure of a ductus arteriosus? So is it A, B, C, D? 40 seconds starts now. All right, so those are the 10 questions. And now let me now transfer you back to Madeline Johanna L. Abraham. Hi, Doc. Are you here?
Good evening, Doc.
Hi, Doc. Good
For
evening. So
coming
glad you could
in.
join us. Ang pretty-pretty naman ni Doktora.
Iba galing akong event. Nanak mo ako. Sorry.
Good evening, Mads. Pare-pare tayong galing ng event. Buong San Beda graduation ngayon. Anyway,
Hi.
do the quiz masters. Okay, and then
Yes,
tatanyayin ko pa, pinapaayos ko pa yung clarifications. May last minute clarifications kasi. So as soon as matapos yung
okay.
PowerPoint, okay, kung pwedeng before the summary lecture, doon ko siya bibigay. Pero kung hindi, I'll go after you after the summary lecture. Okay?
Okay
Your
po, Doc.
show.
So, quizmaster po muna, Doc.
Yes, discuss the answers. Thank you,
Okay
Mads.
po, Doc. Thank you so much, Doc. So, let me share my slides. Kita po ba yung slides?
Kita, Doc.
Okay, thank you, Doc. Okay, so if you're ready, okay, let's start. So, nahirapan ba kayo guys dun sa 10 items? Hopefully, hindi naman, no? Kasi, well, actually, since it's your first Quizmaster session, it might be difficult, but I hope na this rationale would help you remember them if nahirapan kayo or if nakuha niyo yung sagot, then congrats to you. But anyway, let's start with number 1. So, in a pregnant patient taking heparin, APTT is monitored. Toxicity would be subsequently treated with which drug and via what interaction? So the correct answer to this question is letter C, protamine sulfate via chemical antagonism. So when you're looking at the questions sa boards, no, pharma man to or hindi, ang important yung unang i-consider is mag-underline. So, I think that's number 1, no? Try nyo mag-underline. Ako sinasabi ko nun, kahit babuyin nyo yung questionnaire nyo, okay lang. Basta ma-maximize nyo siya until you come up with the answer. So, this patient, in a pregnant patient taking heparin, so that's the drug, APTT is monitored. So, ang in-underline natin dito is toxicity. So, we're focusing on toxicity. So, what is the treatment and what is the interaction? So, that would help you break down or narrow down the answers or eliminate based on the choices. So first, vitamin K biophysiologic antagonism. So that's wrong because ang sabi natin, no, ang vitamin K is an antidote for warfarin. Naloxone is an antidote for opioids. So siguro kung di nyo pa natapos or hindi pa kayo nakapag opioids, no pressure naman kung di nyo alam. Pero hopefully familiar itong drug sa inyo from med school. How about letter C, protamine sulfate via chemical antagonism? Then D, activated charcoal via disposition antagonism. So ito, in terms of an question na toxicology, no, tandaan nyo, pag antidote, you should look at something na opposite dun sa drug. Okay? So kunyari,
Hello, hello.
vitamin, ay, yes po, Doc.
Continue lang, may nag-unmute lang accidentally.
Ay, okay pa. Sige, Doc. So, for instance, ito si vitamin K, kaya natin siya antidote because it's a antidote because warfarin depletes your vitamin K dependent clotting factor. So, diniplete mo yung vitamin K na clotting factors. Anong treatment mo vitamin K? For your naloxone, it's an opioid antagonist. Then, opioid, yun yung gamot. And then this one, bakit ito yung correct answer? Because heparin, you should know this basic principle. So, to those who attended the face-to-face classes, na-emphasize ko dito, heparin is ano nga guys? Sige, na-imagine ko narinig ko kayo ngayon. Parang sabi niyo weak acid. Then protamine is a base. So, being an acid versus a base, therefore, they would form a chemical reaction. So that neutralization action, so acid plus base neutral, that would be chemical antagonism. So therefore, that's the answer. And then lastly, activated charcoal, common antidote, component ng universal antidote natin. And it is used as an adsorbent. So isipin nyo, uling. Okay? Uling na minodified, that's your activated charcoal. So, Doc, okay, sige, alam na namin yung antidote. Ano ba yung types ng antagonism? So, for you to understand it better, no, isipin nyo, pag physiologic, you're talking about what? So, Doc Broly nagturo about physio. It's all about the function. So, physiologic is also known as functional antagonism. So, you're talking about different receptors with opposite effects. Bakit? Doc, pag same receptors, you're talking about pharmacologic antagonism. Anong example niyan? Yung example natin kanina, si naloxone as an opioid antagonist to morphine. And then for physiologic, histamine to epinephrine. Bakit? Guys, pag sinabing histamine, ano yung alam nyong kinukos ng sakit? So, high histamine, histamine is high in allergy. In allergy, meron tayong vasodilation or constriction. Okay, so tama kung naisip nyo, dilation. Kaya ang pula, nag-rashes, namumula pag nag-allergy, anaphylaxis, then bronchoconstriction, di ba? So, hirap huminga. So, vasodilation and bronchoconstriction, that's the effect of your histamine. If you look at epinephrine, what's the effect? Bronchodilation acting in your beta-2 receptors and then vasoconstriction acting in your alpha-1 receptor. So pag tinugman yun, they are opposite effects. Hence, that is your physiologic antagonism. effect yung pinag-uusapan. Pag pharmacologic, again, different receptors, as simple as that. Chemical, acid versus base, or interaction of a compound to a specific functional group, like in your palidoxime, nagbabind siya sa phosphate ng organophosphate. Then si dispositional, dispose, isipin nyo, dispose. So, example nun yung adsorbent na activated charcoal kasi dumikit sa kanya, dun sa charcoal o sa uling. Okay? So, parameter monitored when taking warfarin, that's your prothrombin time. So, mnemonic namin dito ever since med school, no, yung experiment war, XPT war. So, tandaan yun. So, meaning extrinsic pathway measured by your prothrombin time and the drug. This parameter is monitored when taking what drug? Your warfarin. Okay, warfarin is an anticoagulant. Okay, coagulant, baba yung clotting factors. So, prothrombin time yung minimeasure natin. So, anticoagulant choice during pregnancy, pag buntis, tandaan nyo lahat sa pharma. Basta sinabing para sa buntis, must know yon. Bakit? May mga OB examiners, may hilig sila mag-ask nito both sa pharma, across other subjects like OB din. So, tandaan yon. So, pag sinabi anticoagulant during pregnancy, bakit heparin? Heparin na hindi low molecular weight. So, yung normal, yung high molecular weight heparin. Kasi, isipin nyo, di ba, kapag sabi mong absorption, it should go from one area to another through a membrane. So, ang heparin is malaki. So, hindi siya dadaan sa placenta. We're talking about pregnancy. So, it does not cross the placenta. Teratogenic effects of warfarin per trimester of pregnancy, yan, i-memorize na lang. Okay? So, chondrodysplasia, CNS, and bleeding. So, in this question, two statements regarding disulfiram except letter A, an alcohol dehydrogenase inhibitor. Doc, ang hirap ng tanong. So, okay lang yan kasi at least pag lumabas at namali kayo ngayon, siguro matatama nyo na sa board exam. So, bakit letter A? Kasi ang tamang sagot is aldehyde dehydrogenase inhibitor, not alcohol. Okay? So, when you say kasi aldehyde dehydrogenase inhibitor and alcohol dehydrogenase, you're talking about the metabolism of your alcohol. So, when you say alcohol, di ba, we have forms like ethanol, methanol, lahat sila degraded by your alcohol dehydrogenase. After alcohol dehydrogenase, next step is your aldehyde dehydrogenase. So, diniscuss yan dun sa videos niya and lectures, no? Your alcohol dehydrogenase inhibitor is your, sino nakakaalala kaya? So, you can type in the chat box. Or if nahiya kayo, sige, ako nasasagot for you tonight. Sa boards kayo nasasagot guys. So, it's fomepizole. Okay? So, aldehyde dehydrogenase inhibitor, palatandaan ko dyan, D. So, D. Aldehyde disulfiram. Siya yung nag-inhibit ng aldehyde dehydrogenase. Okay? Ngayon, disulfiram, as you mentioned, aldehyde, letter D, aldehyde dehydrogenase inhibitor. Kasi isa alcohol, si fomepizole. Okay? So, it's a CYP450 inhibitor. Paano ba pag sinabing disulfiram-like effect? Ano ba yung manifestations ng patient? Kasi syempre, hindi naman yung clear cut lagi sasabihin na, disulfiram-like reaction. Syempre, pag sa boards, manifestations yan. So, nausea, headache, flushing, hypotension. Okay? So, that's the manifestation. So, again, fomepizole, alcohol dehydrogenase. So, ito mnemonic natin for drugs causing disulfiram-like reaction. So, I met a man who procured and fought for tons of money or pera and died soon. So, yung metazole, metronidazole, cefamandole, procarbazine, cefotetan, and cefoperazole. So, yun, disclaimer guys, corny ako mag-mnemonics. Pero hopefully nakaka-help sa inyo mag-remember during the board exam. So for number 3, so medyo long yung question, no? So I just want to emphasize in this case, so the biology teacher daw developed abdominal cramping, bloatedness, subduodenal stools nung nagko-collect siya ng shells. So pag gano'n, binigay na ganong context, no? Encircle nyo shells. So what's so special about exposure to shells? Tapos meron kang inconspicuous spine on the egg. So it's a combination of micro question, which is very common in pharma. Tandaan yun. Kasi di porket micro tayo dun lang. Tapos gamot dun lang sa pharma. Pwede ipaghalo-halo yan in your board exam. So with your likely impression, what is the mechanism of the drug? So hindi tinatanong yung drug of choice mechanism. The answer is, okay, so kung nakatama kayo, congratulations, increased permeability to calcium. So the drug being referred to here is your praziquantel. Bakit? Anong kinoconsider natin? Shell. schistosomiasis. Okay? So, schistosomiasis has different types. So, discuss that later. Pero tandaan nyo, for this, our drug of choice is praziquantel. So, kung alam nyo na yung impression, schistosomiasis, alam nyo yung treatment, praziquantel, ano yung mechanism? So, ang mnemoniko dito is prazicalcium. So, praziquantel or prazicalcium. So, yung cantel parang pilit lang na calcium. Okay, then the other mechanisms are the following, which we'll discuss later. So, schistosomiasis can either be hematobium, Manzoni, or Japonicum. Paano tandaan, no? So, pag terminal spine, inisip ko yung dulo ng H, no? So, parang yung dulo ng H, mukha siyang terminal, nasa dulo na. Kasi pag si Manzoni, saan yung mahaba? Nasa gilid, lateral. Then si Japonicum mukhang doorknob. Yun yung palatandaan ko. Pero I don't know if it will help you. Or pilit masyado. Pero inisip ko, tingnan yung H mo compared sa M, di ba mas mahaba yung line. So, terminal spine. Tapos ito, nasa gilid kasi may pa-curve-curve pa siya dito. So, lateral spine. Then, Japonicum, mukha siyang doorknob. Yung doorknob na hindi ganito, yung doorknob na gano'n. Okay, so also remember for micro, the sites o the sites that are effective, like for hematobium, di ba hematobium, sakto urinary bladder, hemorrhagic cystitis. Then for Manzoni, so hindi pa kayo nagma-micro, so okay lang naman if hindi pa to super mag-store sa inyo. Basta at least familiar na kayo. Manzoni, inferior mesenteric vein, and then for your Japonicum, both superior and inferior mesenteric vein. Kung pipili, superior ang isasagot. Bakit? Nasa ng Japan versus sa Malaysia. Anong alam niyo sa geography? Ang Japan, mas superior siya, di ba? Mas mataas. Ang Malaysia, mas inferior, mas baba. Okay? So, yun ang pwede niyong tandaan. Okay? So, next. So, again, as you mentioned, for your drugs of choice, for your anthelmintics, so ito, tandaan niyo tong table na to. Kasi we try to summarize kung ano yung mga drugs of choice for helmintic infections. So ito, alam ko, isipin niyo, Dok, ano ba yung roundworms? Ano yung dermatodes? Ano yung cestos? Hindi pa kami nagma-micro. So go back to this table or this concept when you go to your micro. But for now, just remember the generalities. Lahat ng nematode ay albendazole, mebendazole, except these three. So namuni ko, Ivan is a strong oncologist, no? Parang, wala, para madali lang tandaan. So Ivan is a strong oncologist. Tapos doon naman sa pyrantel pamoid, P. So pinworm. Then ito, excuse me for this bastos mnemonic, no? Pero ever since med school, ang mnemonic ko doon, feel the deck. So filariasis, tas deck, DEC. Yeah, so yun yung mnemonic. I'm so sorry. So, feel the deck, DEC, filariasis, diethyl carbamazine. Then for flukes, praziquantel, pati sa tapeworms, praziquantel din. Except which two drugs? So we give your bitinyl for fasciola hepatica and albendazole for, eto, lagi itong tinatanong dalawang to, na hindi sila praziquantel. For your cirrhosis and hydatid, we give now your albendazole. Okay? So I know medyo overload pa kasi hindi niyo pa memorize ano yung cestodes, or kung naalala niyo during med school, then that's good. Okay, so let's proceed. So this one naman would be the mechanism. So as we discussed earlier, praziquantel is calcium. Prazi-calcium. Ba? Prazi-calcium. Sorry. Prazi-calcium. Okay? So yun, para lang madali siyang tandaan. Prazi-calcium. Then yung iba, for azole na anthelmintics, they inhibit microtubule assembly. For your deck, so madaling tandaan, di ba? Feel the deck. So microfilariae, immobilize yung microfilariae. Tapos ito, ivermectin, GABA. So isa din to sa possible na tanungin. For pyrantel pamoate na drug of choice for what? Ano nga? P4? Okay, P4, pinworm. So, depolarizing neuromuscular blocker. So, inisip ko dito, pyre. Nagkakos ng pyre, nag-depolarize. Diba? So, wala, para lang madaling tanong. So, pyrantel pamoate, depolarizing neuromuscular blocker. Then for praziquantel, again, prazicalcium, then niclosamide, ito lalabas to sa, madidiscuss nyo pa to sa biochem dun sa uncouplers na oxidative phosphorylation. Kasi yun yung mechanism niya. Okay, your niclosamide. Okay. So let's go to the fourth question. So for the fourth question, some drugs for diabetes may cause a decrease in the patient's weight, which of the following do not have this effect. So isa sa favorite recurring topics sa pharmacology ang endo. So wag niyo maliitin yung endo, hindi lang puro ANS ang lalabas, hindi lang puro antibiotics. Remember your endo drugs. So the answer to this question, hopefully nakatama kayo dito, is your pioglitazone. So your pioglitazone is your thiazolidine dione. Your metformin is a big one, right? You should remember that. Your glutides, like your mga liraglutide, exenatide, these are GLP-1 agonists. And your canagliflozin is an SGLT2 inhibitor. So our answer is B. So ito, meron tayong mnemonic. So para madaling tandaan, isip ko dito, ginamit ko rin to sa IM kasi tinatanong din to sa IM. So kapag weight gain, so isipin nyo, always sitting, lagi nakaupo. Lagi nakaupo kaya tumataba. So always sitting, sit, weight gain. Weight loss, MSG. Puro MSG lang yung kinakain kaya pumapayat. Although isipin mo, di ba nakakataba yung chichirya? Pero for mnemonic sake, isipin nyo na lang puro betchin lang. So puro MSG, metformin as SGLT2 inhibitor, GLP-1. And then weight neutral yung DPP4 inhibitor. Mnemonic, DPP, D papa taba, D papa bigat for life. Okay? So, madali siyang tandaan kasi compared to the others na may gain or loss, siya neutral. So, hindi pa pataba, hindi pa pabigat. For life is wala lang. Para lang madaling tandaan na DPP4 siya. Okay? So, I hope that these mnemonics help you remember. Sana lang naman. And sana hanggang October umabot. Anyway, so a 73-year-old man was brought for neurology evaluation because of a year-old history of memory impairment, difficulty finding words. Ano yung least likely indicated? So ito lumabas to dun sa recent board, last year na board exam about your anti-Alzheimer's drug. So the answer here is bioperidine. Ang tanong least likely. So automatic dyan, pag may sure ka na dalawa, testmanship din yan eh. Sure ka na dalawa, sure ako, galantamine, ribastigmine. For Alzheimer's yan, memory impairment. So pagbibilian mo na lang dalawa. So you have to know the mechanisms para ma-rule out mo kung alin ba yung answer. So for these, our mechanisms are the following. So we have galantamine, which is an acetylcholinesterase inhibitor, as well as your donepezil, your bioperidine. Sorry, not your bioperidine, your rivastigmine. So your galantamine, donepezil, and rivastigmine are all acetylcholinesterase inhibitors for Alzheimer's. While your bioperidine is an anticholinergic for your Parkinson's. So wag malito. Parkinson's, you have low dopamine. Okay, Parkinson's, you have low dopamine. Okay, remember that. Alzheimer's, you have low acetylcholine. Okay, don't get confused. So knowing that, you would know what drug to give. Alzheimer's has low acetylcholine because acetylcholine is for memory. So I should give a drug increasing acetylcholine. Therefore, acetylcholinesterase inhibitor. Decrease the enzyme, increase the drug. Okay, does that make sense? Okay, again, decrease the enzyme kasi acetylcholinesterase breaks down acetylcholine. Therefore, you increase acetylcholine, increase memory, treatment for Alzheimer's. Then your Parkinson's is mababa naman dyan si dopamine. Okay, so that's in your CNS na i-discuss. But I will discuss your drugs for Alzheimer's versus Parkinson's. So your Alzheimer's drugs, again, we discussed acetylcholinesterase inhibitors versus your Parkinson's drugs, which can have several mechanisms. Again, low dopamine. So drug mo, mainly first line, dopamine, like levodopa plus carbidopa. That's your first line. You can also give the others, these other drugs. But your antimuscarinics are these three. Okay, so we have mnemonics for these. Later, you would learn about it. So, ang gusto ko lang munang i-share na mnemonic. So, ito yung for Alzheimer's na drug na drugs na lumabas daw no October boards last year. Si Don Pepe nakitang gumagala sa river kasi may Alzheimer's. So madali siyang tandaan, no? Don Pepe Gala River was Alzheimer's. Okay, so remember this mnemonic just in case mabas ulit. So another mnemonic naman for your anti-Parkinson's drug. So ang dami mong sasakyan. So ang papark mo yung bicycle, yung tricycle, at saka yung Mercedes-Benz mo. So these are your anticholinergics for Parkinson's. Okay, remember these three anticholinergics for Parkinson's. Number 6, in patients diagnosed with pseudomembranous colitis, we prescribe locally available drug to be taken orally. This drug acts by which mechanism? The correct answer to this is A. Reactive reduction by ferredoxin-forming free radicals that disrupt electron transport chain. Doc, ang hirap ng tanong. Okay. So, ganun talaga ang board exam. We can predict kung mahirap talaga ang madali. That's why we expect the worst. And we hope for the best. So, again, we underline pseudomembranous colitis. Pseudomembranous colitis usually caused by, usually clindamycin, ano pa? Your? Okay, mukhang narinig ko yung minds na ampicillin. Ano pa? Cephalosporins. Those are three most common causes. Now, we are talking about the treatment. The treatment. Iba yung drugs na nagkukos and iba rin yung drugs na pinang-treat. Okay? So, tandaan yun. Treatment versus cause. Ang tanong, ano daw yung action no treatment na drug? So, the treatment muna, first and foremost, is your metronidazole. We also have other treatments, I'll show that later. Therefore, knowing na metronidazole treatment, so kailangan mo na alamin kung ano yung mechanism niya. So, basta metronidazole, tandaan nyo guys, buzzword is free radicals. Okay? Metronidazole, buzzword is free radicals. So, for the others, so read nyo na lang, mnemonic dito yung binds at 30, cells at 50, so other protein synthesis inhibitors acting on 50S. Then ito nagbabind sa PBP or your penicillin binding protein or your beta-lactam antibiotics. Then yung interferes with your nagmix up lang, sorry, bacterial DNA synthesis by your DNA gyrase via your quinolones. Okay? Tandaan niyo itong DNA gyrase. Kung magtatanong ng mechanism ng quinolone, yan yung buzzword. DNA gyrase. Ako inisip ko dyan yung G mukhang Q. Pilit siya guys, pero yung gyrase sa quinolones lang yan. So, para matandaan nyo. Okay. Okay, so the answer is A. So for this one, organism associated with pseudomembranous colitis, sige nga, the answer, your C. difficile, Clostridium difficile. So as I mentioned, your pseudomembranous colitis has different causes and has different treatments. So for causes, clindamycin, ampicillin, and cephalosporin are the most common. But according to Harrison's, virtually all antibiotics can cause your pseudomembranous colitis. All. But the three are the most common. Pero virtually all. So kung meron pa rin choices sa IM, kunwari tanungin, all of the above. Kasi lahat ng antibiotic pwedeng mag-cause. Pag hindi tayo ng most common, all pa din yung sagot. Treatment, as I mentioned, metronidazole. Pero ano tong dalawa? So we also have oral. Tandaan nyo, for pseudomembranous colitis, we want oral agents. Your vancomycin and fidaxomicin na oral. What we have in the Philippines is your parental vanco. But we can only use oral vanco for your pseudomembranous colitis. Therefore, in the Philippines, anong treatment natin? Still your metronidazole. Okay? So your fidaxomicin is a macrolide. So take note of this drug. It's not commonly asked and it's not really that common. But I want to discuss this drug to you. Bakit? Kasi yan ang only indication ng gamot na yan. So kung matatanong yan sa boards, might as well know it kasi ginawa siya for that. So yun lang yung use niya. It's only used for pseudomembranous colitis and nothing else. So take note that this is a macrolide and don't get confused. Kasi I'm sure kung first time niyo mabasa, actually kahit ako, kung first time ko ito mabasa, kala ko ano siya, aminoglycoside. Kasi tingnan nyo, myosin. Eh, yun pala, kahit na myosin siya, it's a macrolide. So iba lang yung species siguro na pinagkunan ng antibiotic. So it's a macrolide. Kahit na myosin, MY, yung mga macrolide. So take note, it's used again for pseudomembranous colitis. Okay, so 7, atorvastatin may be given daily to the following patients except, so the answer is C. 36-year-old male with ASCVD, 10-year risk of at 6.5%. So ano concept yung kailangan natin tandaan dito? Yung apat na statin benefit group. So napapansin nyo, nag-overlap tayo ng micro, ng IM. Ganun kasi sa boards, no, talagang umiikot siya. Ang important is makuha niyo yung concept para kahit saan siya tinanong, pwede niyo masagot yung tama. Okay? So the answer again is your letter C. So, when we say kasi atorvastatin, of course, this is statin, HMG-CoA reductase inhibitor in terms of mechanism. So, bakit mali yung sinasabi natin dito, no? Except yung tinatanong. So, kay letter A, bakit mo kailangan magbigay? Kasi may unstable angina siya. So, that's already a clinical atherosclerotic cardiovascular disease. For letter B, bakit mo kailangan magbigay? Kasi LDL niya more than 190 na. So, pasok na siya sa cutoff. Si letter D, kailangan mo rin magbigay kasi meron kang diabetes mellitus. Unlike sa letter C, 6.5% lang dapat more than 7.5. So medyo tricky siya, no? So you should remember this for statin benefit groups. So remember this also in your IM if hindi niyo pa siya memorize ngayon. Okay, so pronounce over ko lang kasi it can also be asked in. Okay, so again for statins.
Ay, nawa.
Lala, pa-mute yung mga tao.
Na-mute ka na daw.
HMG-CoA reductase inhibitor. So in terms of statins, it can either be high, moderate, or low intensity. This you must memorize. But how do you memorize? To simplify things, I always remember the high intensity dose. And I always remember ang atroso walang low, hindi natin ginagamit na low intensity. Okay? So at least ito man lang, kahit yung 4 lang na naka-red, yung ma-memorize. Okay? So remember that. And then let's move to your number 8, the chemo drug vincristine, used for leukemia and lymphoma, acts on which particular phase of the cell cycle. So that is your phase M. So phase M, for these phases, no, I'll show you the mnemonic. So tinanda ko dito, MTV, M. So sa phase M, TV, taxanes, and vinca. And then, doon naman sa phase G2, anong second letter ng alphabet, guys? Letter B, so symbleomycin. Sorry for the typo, it should be bleomycin. Sa letter S, synthesis, so anti-metabolites, mga purine pyrimidine analogs. Then the rest is G0 na, para madaling tandaan. So the answer is letter C. So ito, no, summary lang no mnemonic natin na diniscuss ko earlier. So you have this figure na in your handout. You can just use the mnemonics I shared for you to remember them better. So again, MTV, letter B, second letter, anti-metabolites, kasi pyrimidine mimics, then the rest are G0. Okay, remember. So rescue therapy for methotrexate toxicity, tandaan nyo itong mga rescue agents sa chemo, hindi siya masyado tinatanong sa boards, pero at least remember nyo itong mga toxicity and antidotes. So that's your leucovorin, also known as your folinic acid. Methotrexate, antidote, folinic acid, or leucovorin. Bakit? Dok, ano ba mechanism ng methotrexate? It's a dihydrofolate reductase inhibitor or your folate antagonist. Tanggalin mo si folate, anong antidote? Taasan mo si folate in the form of leucovorin, also known as your folinic acid. Okay. Next, rescue therapy for your cyclophosphamide is your MESNA. Okay, your MESNA. Rescue therapy for doxorubicin is your dexrazoxane. Madaling tandaan, parehas may XX, dox tsaka dex. Okay, antidote for dox is your dex. Okay, dox, dex. And then, rescue therapy for your cisplatin is your amifostine. Paano tandaan? Tin. So, tin. So, cisplatin, amifostine. Okay? And then, second to the last, number 9, which should following your muscle blockers undergo Hoffman elimination yielding a seizure-causing substance. So this was discussed in your handouts, no? So the correct answer to this question is your D, atracurium. So your D, atracurium. So ang pancuronium, ano ba yun? So pancuronium curare. It's a curare drug. See, curonium curare. So it's a non-depolarizing neuromuscular blocker. Next, succinylcholine is a depolarizing neuromuscular blocker. Ang iniisip ko dyan, succinylcholine, pag sabi mo depolarizing, merong initial, parang pinagod mo. Spasm, or contract. Pag sobra na ng contract, napagod na, nag-relax. That's why causes muscle relaxation after it causes initial spasm. So yun ang depolarizing your muscular blocker na sinasabi. Again, then itong si tubacurin, it is a derivative lang naman ng curare din, parang si pancuronium. And then si atracurium, our answer, is a non-depolarizing, like your curare. So itong A, C, and D are all curare compounds. So ito, mnemonic natin, no? Kung corny na kayo, I'm so sorry. Sana na lang guys, maka-help. So for this, Ate and Sis shouted loud and they saw a hot man having seizures. So pilit na pilit ko itong ginawa nung nag-aaral ako for boards. So Ate and Sis shouted loud. Ano yung loud? Laudanasin. Yan yung nagkakos ng seizure. When they saw a hot man, so Hoffman having seizures. Okay? So kahit paano kung familiar kayo sa mnemonic, makita nyo lang yung question sa boards, yung mga choices. It will help you na remember. Okay? So ate, atracurium, tsaka sis atracurium. Loud, shouted loud, laudanasin. When they saw a hot man, so Hoffman having seizures. Okay? Di ba papatili ka nga naman kung kita mo yung seizure. Tapos sabi, hot man pa. Okay, last question. So, prostaglandins analogs are commonly utilized in both obstetrics and pediatrics. What is false? So dito, the correct answer is D. Alprostadil is a synthetic prostaglandin commonly used for medical closure of adultus arteriosus. So actually guys, ganun sa boards, maraming except, maraming which is false, unfortunately, ganun sila magtanong. It's not the right way of answering or making a quiz or an exam, pero unfortunately that's how they do it on the boards. So you should be prepared. Hindi kayo maduduling na akala nyo identify the truth, tapos in-answer nyo yung true kasi nabasa nyo yung A, tama agad, nag-shade agad ng A. So be careful. You have to read at least twice yung questions natin before answering, especially hindi yung agad-agad mag-shade, no? So for this, D, because your alprostadil being a prostaglandin, it keeps your ductus arteriosus patent. Okay? So why? Your ductus arteriosus is kept patent by increasing prostaglandin. And then what closes it? Itong sinasabing medical closure, ano to? Anong drug to? Your indomethacin. Okay, remember that. So this is caused by your indomethacin. So your indomethacin, kung hindi indomethacin yung ilabas sa boards, pwedeng your ibuprofen. Okay, but if you had to choose one, answer nyo indomethacin. So yun, ginagamit natin to close your ductus arteriosus. Paano tandaan? Indomethacin is the prostaglandin inhibitor. It's an NSAID. It's a non-selective COX inhibitor. Therefore, inhibiting your prostaglandin. Again, to keep the ductus arteriosus patent, open it, di ba? Using prostaglandin, your alprostadil as a drug. Then, to keep it close, you decrease prostaglandin using an NSAID, a COX inhibitor, your indomethacin. Okay? So that's how you close, that's how the ductus arteriosus works. So tandaan niyo yung extremes, increased versus decreased prostaglandin. So just memorize this. You have this in your handout, your prostaglandin analogs, and I highlighted here the indications. Tandaan nyo, yung PGE1 analog, yung misoprostol, NSAID-induced ulcer, yan yung FDA-approved use niya. Your alprostadil to maintain patent ductus arteriosus, your dinoprostone, sulprostone, yung mga prostone for your labor induction, and then your carboprost, latanoprost, so PGF2E yan. So different uses. For carboprost, for postpartum hemorrhage, then your latanoprost for glaucoma. Then lastly, your prostacyclin or your PGI2. So same lang to guys sa prostacyclin, baka yun yung labas sa boards, hindi PGI2. So this is your prostacyclin. These are the analogs. Ang commonly tinatanong your epoprostenol causes is used for pulmonary hypertension and ano pa? As a prostacyclin, sino kaaway ni platelet? Si prostacyclin. So it reduces platelet aggregation, okay, in dialysis machines. Okay. So to finish the quizmaster, no, drug used for medical closure of PDA, that's your indomethacin and ibuprofen, as I mentioned. Why? Decrease prostaglandin. Why? COX inhibitor, hence it's an NSAID, diba? And then your congenital infection, so crossover ng PD or micro, associated with PDA, that's your rubella. Okay, remember nyo to. Pag rubella, isa sa mga associated manifestations of your patent, doctors, arteriosus. Okay, so that's it for our Quizmaster session. Thank you po, Doc. Do you have any questions?
Let's
Meron
have
bang may
a
questions? Meron bang may questions kay Doc Mads? Doc, walang nag-send ng questions actually.
intensive naman yung discussion din kasi ni Doc Mads. Highly
Hmm.
appreciated. Maganda yung ano. Gusto mo muna mag-break, Mads, before you have your summary lec? Okay, so
Noted po.
everyone, let's have a 5-minute break muna. And then, Doc Mads, 10 minutes before you end the summary lecture, i-message mo lang yung si Lala para tawagan ako.
Okay
Para
po, Doc.
yung bibigay ko yung clarifications after your summary lecture kasi. Okay?
Okay po.
Bigyan mo lang
Okay
siya
po.
bigyan mo lang ng clue si Lala. Okay. Sige, break muna tayo,
Thank you
5
so much.
minutes guys. Mag-CR muna yung iba. Maka-CR din si Mads, maka-prepare ng konti. Okay.
Sige, Doc. Thank you, Doc.
Nawala yung music.
Hi, doctors. Ready na ba kayo? So, let's resume. I'll just share my slides. Hold on. Wait lang mga. Okay. Okay. So, if ready na kayo, since you discussed your Quizmasters first kanina, siguro some of the concepts there na nandito, hindi ko na i-elaborate, no? Gusto ko lang sabihin sa inyo na ang pharmacology, it's something na namamaster mo with repetition. So, huwag kayo masyado kabahan kapag di nyo pa nagaget sa umpisa. Tandaan nyo, kakastart pa lang naman ng pharma, you still have your master period, you still have your pearls. So, you have to give yourself a chance then to understand before you memorize. Okay? At ang pharmacology sa boards, the bare minimum is always to know the class. So, at least yung class man lang alam nyo. That would be helpful. Okay? So, if G na kayo, let's start para makapahinga na rin kayo at maka-aral pa kung gusto nyo pa mag-aral tonight. So, first is discuss the basic principles of pharmacology. So, dito, gusto nating laging kino-compare your graded versus quanta dose response curve. So, tinatandaan ko dito are the concepts of efficacy and potency, tsaka yung concepts ng median effective dose versus your median toxic or your lethal dose. So basically, kapag sa boards, meron dong concept na from the name itself, malalaman mo na yung definition. Hindi ko na siya masyado minamemorize. Kasi kung makukuha ko naman na siya based dun sa definition, hindi ko na siya kailangan pag-aksayan ng mas maraming brain cells. Kasi tandaan nyo, syempre, sa sobrang daming naaral nyo for boards, as you approach the last few subjects, talagang masasaturate kayo and feeling nyo na hindi na kaya kasi naubos na yung brain cells nyo. So might as well, itipid nyo siya para dun sa kailangan nyo lang, yun lang yung memorize nyo. So for this one, graded. Sa graded dose response curve, you're talking about efficacy versus potency. Efficacy, obvious naman yan, the maximal effect. Ang gusto ko na emphasize siguro yung potency. When you say potency, it's a measure or concentration of the drug wherein half of the maximal effect is achieved. So, half of the maximal. Dok, paano madaling tandaan? Our label is 50. That's half. Ibig sabihin nito, it is the concentration, hence C, concentration at which 50% of the effect, letter E, is achieved. And then your median effective dose, which you obtain from your quantal dose response curve, it is the dose, letter D, wherein 50% respond sa population. So may effects of 50%. Then your median toxic or lethal dose, it is the dose, letter D, wherein 50% or half, same pa din, half toxicity or lethality or death. Okay? So, define siya based dun sa code or dun sa name mismo ng concept. So, yung namuni ko dito is your AB. So, naturo ko to nung mga nag-face-to-face, no? So, nalaman nyo naman doon, corny talaga ako mag-mnemonic. Pero up to you again, up to you guys, kung gagamitin nyo, basta kung anong makakabuti sa inyo. So, ang sikip if farin. Papalit daw tayo ng van. So, again, when I make mnemonics, tinatry ko na kung ano yung mnemonic nandun siya sa, nandun yung hinahanap. Kasi, hindi ko matatandaan eh. Mangyayari, alam ko lang yung mnemonic, hindi ko alam kung para saan siya. Okay, so, para madaling tandaan, ang sikip kasi narrow therapeutic index. Again, ang sikip kasi narrow therapeutic index. So ito yung drugs. So for this, we don't have the luxury of time, so I want you to memorize. But apart from memorizing, I want you to always define the class. Again, bare minimum natin for the board exam is to know at least the class of drugs. Okay, the class of the drug. So amphotericin B, yan, it's an antifungal, di ba? So, amphotericin B is an antifungal. Your aminoglycosides is a antibiotic. Your carbamazepine, your phenobarbital, and phenytoin are anticonvulsants. So, when you when you memorize your drugs, you can also classify based on class. So, carbamazepine, phenobarbital, and phenytoin. So, alam nyo na, may tatlong anticonvulsants na may narrow therapeutic index. Ano pa? So, warfarin is an anticoagulant, your lithium, drug for bipolar, digoxin is a cardiac glycoside for your heart failure, and then your theophylline is a PD inhibitor for your asthma, COPD, so it's a bronchodilator. And then your vancomycin again is an antibiotic, as with your aminoglycoside. So, tandaan, may dalawang antibiotic na may narrow therapeutic index. So, again, remember this mnemonic. So, we have naman your first versus your zero order elimination. Pag tinuturo ko to sa students, ano lang gusto kong tandaan nyo? Pag first order, we eliminate a constant proportion. First order, constant proportion. Zero order, we eliminate a constant amount. Okay? We eliminate a constant amount. So, ibig sabihin natin doon, kung dito, constant proportion tayo, tapos dito, we eliminate a constant amount, ibig sabihin, no matter what happens, dito sa zero order, 2.5 lang tatanggalin ko as an example in this figure. So, kahit pa nag-start tayo ng 10, next natin is 7.5. Tapos minus 2.5 is 5. Minus 2.5, 2.5. So, same amount yung tinatanggal hanggang sa maging 0. Then, si first order, nag-start tayo ng 10. Kunyari, para maging half, kunyari. 10, half ng 10 is 5. Half ng 5, 2.5. Half ng 2.5, galing nyo naman mag-math. So, 1.25. Half ng 1.25 is 0.6125. And so on. So, ibig sabihin, hindi to point. Ayan. And so on. So, ibig sabihin, in first order, you don't reach 0. Tignan nyo. It continues up to, it is continuous na magiging exponentially nagde-decrease. So, pag ganyan siya. Well, your zero order reaches 0. Kaya siya tinawag na zero order. So, it reaches 0. 0. Zero order. It's a line. Why line? Yung slope niya, yung constant amount na tinatanggal mo, which is here, 2.5. First order, exponential decrease kasi proportion ng tinatanggal mo. Kalahati parate eh. Okay? So therefore, the elimination rate in your first order is proportionate to the concentration. Dito, the elimination rate is always constant kasi same amount yung tinatanggal mo. Okay? So with that, our mnemonic is what pet. So tall what pet ang walang order. So aso. So walang order kasi zero order. So drugs with zero order kinetics are the following. So your what pet. Warfarin, heparin or anticoagulants, aspirin is an anti-platelet, tolbutamide is a sulfonylurea, di ba, for diabetes. Phenytoin, anticonvulsant, ethanol, an alcohol, then theophylline, a bronchodilator. Remember this mnemonic. Another mnemonic. So ito, nice. 9 nice continuous drugs and meds have less effects. So ito medyo mahirap tandaan yung mnemonic. Pero kung desperado na rin kayo, gaya ko nung nag-aaral ng boards, pa din siya gamitin. So less effect kasi tachyphylaxis. If you remember, what is tachyphylaxis? Tachyphylaxis with continuous exposure, continuous use of the drug, nagde-decrease yung effect at a short term. Tandaan nyo, short term. Pag long term, sabihin, ginamit mo ng isang dekada mo nang ininom yung gamot. Nitrates ka isang dekada. Nagka-tolerance ka. So, with long-term use, that's your tolerance. Again, tachyphylaxis, short-term use, tolerance, long-term use. Para sila ng gradual response to the drug. Gradual decrease in response to the drug. Okay, so this is your mnemonic. Then next natin, so, okay, sorry. This is the continuation pala of my mnemonic. So, yung 9 nice, continuous drugs and meds, so MED, have less effects. Pero ang tatanungin niya ako, Doc, high yield ba? Actually, hindi. Hindi siya masyado tinatanong. Pero kung mayroon lang kayong tatandaan na kung mani nagpe-present with tachyphylaxis, tandaan nyo at least it's dobutamine. So, dobutamine commonly presents with tachyphylaxis. So, phases of clinical trials, di ba complicated yung figure, dami sinasabi. Pero in general, pag phase 1, unang-unang mo gusto malaman sa gamot, okay ba to? Safe ba to? So safety, less than 100 subjects. Phase 2, effective ba to? Kasi alam mo na kung safe eh. So next is to know na effective siya. So that's in more. So more than 100 or less than 1,000. Then pag alam mo na safe daw siya, effective siya, phase 3 therefore is your safety and efficacy. So that's your more than 1,000. Then your last phase, your post-marketing surveillance, yan yung sinabak mo na sa tens of thousands or hundreds of thousands na tao kasi alam mo na safe at effective. So again, safety, efficacy, post-marketing. This is also applicable for your PrevMed pag lumabas. Then for your common teratogen, so ito ang dami, no? Since summary lecture to, niread na natin yung important. Remember, ACE inhibitors can cause fetal renal damage or fetal agenesis in your second to third trimester. So again, ACE and ARBs to. Okay? ACE and ARBs, also your angiotensin receptor blockers. Ano pa bang gusto ko emphasize? Your lithium causes your Epstein anomaly. Okay? Your isotret causes your craniofacial malformations. Mobius in misoprostol. Cutis laxa in penicillamine. Phocomelia and thalidomide. And aplasia cutis congenita in metimazole. Okay, so ang dami guys, since we're just summarizing everything, I want you to take note of those na nakabold na red. Okay, and what else? Siguro kung may dadagdag ako this one pa, madalas tanungin sa exams. Your diethyl silvestrol can cause vaginal clear cell adenocarcinoma. Okay, so that's also a commonly asked question. So remember these drugs. So ito kasi, it's not something to be explained. It's something talaga na may na-memorize. So yung ganito, dikit nyo sa wall nyo, print nyo, just memorize. Okay? Now for your autonomics, okay, mag-emphasize lang tayo ng particular drugs. So for your autonomics, ang gusto ko lang emphasize dito, you have kasi your cholinergic versus your adrenergic neurotransmitter. So cholinergic, then you also have your adrenergic. Okay? So first dun sa cholinergic, ang important dito, na-emphasize ko parate, yung which steps are targeted. So for your synthesis step, palitanda ako dito, hemi, kalahati pa lang, hindi ko pa nagagawa. Ginaya niya si acetylcholine. So hemi-choline yung synthesis phase. Anong counterpart sa adrenergic? Anong precursor amino acid ng mga adrenergic neurotransmitters? Tandaan niyo to, tatanungin ito sa biochem. Precursor amino acid ng neurotransmitters is your tyrosine. Hence, tyrosine is an inhibitor nung synthesis kasi hindi siya totoong tyrosine. So, kinokontra niya yung totoong tyrosine. Ito naman, hemicholine yung. Kasi kinokontra niya yung, di ba, acetyl-CoA plus choline. So, hindi ka makaka-form. That's your synthesis phase. Then storage, para madaling tandaan, vesicle. Vesicle is used to store. Reserve is also known as storage. So vesamicol and reserpine both target the storage. Okay, tandaan yan. Both target the storage. Difference, vesamicol is cholinergic, reserpine is adrenergic. What targets the release? Your botulinum for cholinergic. So ito yan. So inhibits the release, kaya kami flaccid paralysis. Guanethidine inhibits your adrenergic release. And then in terms of termination, ibig sabihin, mawawala yung effect. Bakit? So either i-metabolize mo siya because of the enzyme what? Acetylcholinesterase. Again, acetylcholinesterase is the enzyme that degrades acetylcholine targeted by your several drugs including your stigmine, your neostigmine. And then your other inhibitors of metabolism are your MAOI and your COMT or your MAO inhibitors and catecholamine O-methyltransferase, which are adrenergic drugs targeting the metabolism. Why? Ano nga? Enzyme ito tinatarget sa acetylcholinesterase. Ito rin. Monoamine oxidase tsaka catecholamine O-methyltransferase. Okay, yun yung mga tinatarget na enzymes. And then lastly, your cocaine. Your cocaine targets the uptake. So ito yan. Cocaine plus, okay. So memorize nyo to. Cocaine and TCA. Star natin yan. Pag sinar ko, sabihin, dadaanan, ulit, dadaanan, days, weeks, little time before the burst. Kailangan alam niyo yung mga nakastar. Your cocaine and TCA inhibit the reuptake of your norepinephrine or your adrenergic neurotransmitters. Okay? Cocaine and TCA. Okay. Ngayon, gusto ko lang emphasize tong table na to kasi gusto ko maintindihan nyo maigi. Pag sinabing mimetic, same. Pag lytic, different. So, itong mga parasympathomimetics, yung mga ang action ay parasympathetic. Yun yung mga cholinomimetics, agonist, muscarinic nicotinic agonist, or kabaliktaran kapag lytic. So, then adrenergic alpha magkaanak si balit, no? Then, ang manings parasympathomimetic ay dumbbells. Okay? So, ito memorize nyo na lang to from your handouts. In short, pag parasympathomimetic, digest. See? Rest and digest. So, sympathomimetic, just the opposite. Di na natin isa-isahin. But, ano mong tatandaan? Si Alice in Wonderland. Again, ulit-ulit. Muscarinic effects, dumbbells, rest and digest. Anti-muscarinic effects, your Alice in Wonderland symptoms. Hot as a hair, dry as a bone, red as a beet, blind as a bat, and mad as a hatter. Okay. Okay, so tinanong sa recent boards, atropine side effects except? So ano yung hindi side effect ng atropine? Ano kaya? So sagutan ko na since dahil pa natin di-discuss. That's your diarrhea. Okay, bakit? Side effect pang diarrhea? Hindi. Yun ang isa sa opposite or sa use niya. Kasi your diarrhea is part of your dumbbells, which is again, dumbbells. Muscarinic. What's atropine? Anti-muscarinic. Okay? So, itong B to D, tama yan. These are side effects. Diba? So, common drugs lang na para sa pathomimetics, emphasize ko lang, no? Yung uses nila. Yung mga col, botanical, carbachol, these are used for your bowel and bladder atomy. Okay, your bowel and bladder atomy. Pilocarpine used for your glaucoma. So at this point, medyo nabasa nyo na. So refresh lang tayo. Nicotine and varenicline for smoking cessation. Difference. Full C nicotine, partial C varenicline. How about your succinylcholine? It's again, sinabi natin kanina, depolarizing. Contract muna bago relax. Hydrophonium versus your carbamates. So versus your stigmine. So these are all acetylcholinesterase inhibitor. Okay, they all inhibit the degradation of the enzyme. In terms of use, the hydrophonium, diagnosis. Carbamates, treatment, especially your neostigmine. Physostigmine, atropine toxicity. Organophosphates like your, malathion, parathion, may mga thion. So having a thion in the compound, having a thion, allows them to have covalent bonds. Tandaan nyo to. Pag covalent bond, permanent, matagal, irreversible yung gamot. Okay? Permanent, matagal, irreversible yung effect ng gamot. So, may insecticide toxicity. And then lastly, ito hindi tinatanong masyado, airborne nerve gases. So, antidotes natin for organophosphate poisoning are your atropine versus your pralidoxime. So, your atropine, again, ulit-ulit tayo, is an antimuscarinic. Your pralidoxime naman, ito yung emphasize ko, it addresses both nicotinic and muscarinic symptoms ng organophosphate poisoning. Bakit? Because your pralidoxime regenerates your cholinesterase. How? Si organophosphate ay acetylcholinesterase inhibitor. Again, acetylcholinesterase inhibitor. Si pralidoxime ay acetylcholinesterase regenerator. Bakit? Anong gagawin niya? Si pralidoxime acts as a chemical antagonist. How? It will bind, kakapit siya dun sa phosphate ng organophosphate, para hindi na siya makakapit kay acetylcholinesterase. So, mangyari, na-regenerate sa acetylcholinesterase. Siya na lang natira. Hence, na-treat yung toxicity. What's good about pralidoxime? It addresses both nicotinic and muscarinic symptoms. Why? Dito, it's an anti-muscarinic. So, muscarinic receptor lang kasi yun yung pharmacologic antagonism na involved. Dito, kay pralidoxime, both nicotinic and muscarinic kasi your pralidoxime regenerates acetylcholinesterase. So, wala akong pake kung sa muscarinic ako kumapit or nicotinic. Ang mahalaga, free up ko si enzyme, si acetylcholinesterase. Okay? I hope that made you understand. So, ito, na-discuss na natin itong pneumonia kanina, no? So, skip na natin yan. So, ito, parasympatholytics, emphasize ko lang. We have your zapins. So tandaan nyo, yung dalawang zipin-zipin are for peptic diseases. Although usually peptic acid disease, what do we use? Your proton pump inhibitors, your H2 blockers. Okay, or also your antacids. But first line, proton pump inhibitors like your omeprazole, ano pa? Pantoprazole, esomeprazole. For your phenacin, tsaka oxybutynin, not that common na drugs. You just have to know the, the uses kasi tinatanong pa rin yan sa boards. You have your urinary urgency and urinary incontinence. Bakit? Para sympatholytic to. So, ibig sabihin, imbis na rest and digest, kabaliktaran. So, hindi ka iihi. Therefore, kung ihi ka ng ihi, pwede mo itong gamitin. Your diphenacin and oxybutynin kasi it will stop the urine flow. Okay, so urinary retention, di ba yung side effects? So, sabihin, contains the urine. Your atropine, we already discussed this. So, ito madalas tanongin your hexametonium tsaka your trimethophan. They are NN, nicotinic neuronal or your ganglionic blockers. Okay, your ganglionic blockers. And as you mentioned, your curares are neuromuscular blockers. Okay, your neuromuscular blockers acting as, neuromuscular blocker. So, skeletal muscle relaxant. Okay? So, your sympathomimetics naman na important, we have your norepinephrine, drug of choice for septic shock. Okay, septic shock. Pag anaphylaxis or anaphylactic shock, epinephrine. Bakit nga, Doc? Tinuro ka na kanina. It's a physiologic antagonist of your histamine. Si epinephrine, bronchodilation and vasoconstriction. Kabaliktaran ng effects ng epinephrine. Dopamine, ang tandaan nyo, is renal failure. Drug of choice for shock, any type of shock with renal failure. Why? Your dopamine increases your RBF, also known as your renal blood flow. Okay, isa sa effects ng dopamine yun. It increases your renal blood flow. Next, your phenylephrine and oxymetazoline, these are your decongestants. How? They're alpha-1 agonists. Alpha-1 agonist, ibig sabihin, they constrict. Ano ba kapag sipon? Dilated. Kaya sinispon. So, to decongest you, constrict. So, use an alpha-1 agonist. Clonidine can cause your rebound hypertension. Clonidine and methyldopa are alpha-2 agonists. Okay? So, tinatanong din yan. Ano favorite tanongin kay methyldopa, Doc? Side effects. So, tandaan niyo to. For clonidine methyldopa, ito yung pwedeng tanungan. Rebound hypertension and sedation tsaka hemolytic anemia. Okay? Sa methyldopas or positive Gun's test. The butamine, again, sabi natin kanina, tachyphylaxis. Ano pa? Eosinophilic myocarditis. Okay, eosinophilic myocarditis. It is also used as one of the drugs of choice for cardiogenic shock. So, anaphylactic, epinephrine. Septic, norepinephrine. Cardiogenic, dobutamine. So, also component of your cardiac stress test. Then lastly, ito, ano to mga to guys? These are, kung nabasa nyo, beta-2 agonists. So, these act as tocolytics or prevent premature labor. Then, lastly, you have your Fe. So, tandaan nyo, Fe. Phenoxybenzamine, pheochromocytoma, phentolamine, pheochromocytoma. Difference, phenoxybenzamine, mahaba. Ito yung irreversible. Phentolamine, maikli. Ito yung reversible. Both are alpha blockers. Okay, alpha blockers. And then your azosine or sulocine. These are your drugs for anong sakit, guys? Na counter nyo sa patients, your BPH. What to remember? Your adverse effects of first dose phenomenon or orthostatic hypotension. Okay, remember that. And then ano pa? In terms of selectivity, guys, sa mga blockers na to, alpha-1 blocker. Okay, alpha-1. Hindi siya non-selective. Ang non-selective alpha blockers are your Fefe, and then yung mga selective are your zosine. Alpha-1 blockers. Okay, so your beta blockers include the following. Emphasize ko na lang, since this is summary lecture. Small is half-life. Nadolol, nasa dolo ang half-life. Then palatandaan ko dyan, carve the label. So carve the label kasi your carvedilol and labetalol have alpha and beta blockade. So special sila kasi they block both alpha and beta. And then your nebivolol, paano tandaan? N for nitric oxide and B for nebivolol, BI for beta 1. Okay, so Nebivolol causes nitric oxide release and beta-1 blockade. Okay, so beta-1 tsaka nitric oxide. Again, nitric oxide tsaka beta-1 mechanisms ng nebivolol. Then si carvedilol, alpha, and beta. So inisip ko dyan para kang nagka-carb, di ba? Alpha, sipin nyo na lang. Tsaka beta. So carb, the label. Okay. So next, CV drugs na tayo. So gusto ko tandaan nyo dito sa CV drugs, yung diuretics natin, particularly these examples. So your acetazolamide mechanism, carbonic anhydrase inhibitor. Saan location, Doc? Proximal convoluted tubule. Your semide, carbometanide, so medyo na iba, no? And your ethaclinic acid are loop, acting on the loop of Henle. So remember, ang gusto ko tandaan nyo, ethaclinic acid. Iba itsura, iba pangalan. It is the loop of choice for those with sulfa allergy. Bakit? Magkakamuka itong tatlo. They have sulfur component, but your ethaclinic acid is not a sulfa drug. Hence, it can be given to patients with sulfa allergy. Okay? Patients with sulfa allergy. Okay, wala siyang sulfur. Your thiazides, your hydrochlorothiazide, chlorothalidone. So these are thiaziduretics acting on the DCT. So TZD acts on your DCT. Palatandaan ko for that. And then yung spironolactone is an aldosterone antagonist, while your eplerenone is an ENaC inhibitor, which are acting on the collecting ducts. Okay, remember these mechanisms at least, no? And also your, spironolactone and eplerenone, spironolactone and eplerenone are aldosterone antagonists, while your ENaC inhibitors are amilorine and triamterene. Okay, amiloride and triamterene. So, amiloride, triamterene, ENaC inhibitors. So, ito, mnemonic ko dito, no, na-share ko nito sa mga naturuan ko before. Your na bakla ka. So, mnemonic sa antiarrhythmics, na bakla ka. Sodium, beta, potassium, and calcium channel blockers. So, for antiarrhythmics naman, di ba, na bakla ka, class 1, class 2, class 3, class 4. Under class 1, so these are all sodium channel blockers. You have your A, B, and C. Mnemonic. So, kung di pa kayo nag-dinner, no, gutumin sana kayo sa burger na to. So, double quarter pounder, fengeng, lettuce mayo, tomato, kasi ito. Dami kasing P eh, para madaling tandaan. Engeng, so NK knife, more fries, papo. So, yung papo is propafin. What else? Tandaan, effects on action potential duration. Class 1A, A4, akyat. Class 1B, B4, baba ang action potential duration. Class 1C, C, constant ang action potential duration. Okay, so yung mechanisms nila in terms of acting on your action potential duration. So, please guys, remember this mnemonic kasi pwede siya matanong. Okay, so doon naman tayo sa drugs for dyslipidemia na tatanong sa boards. Pag tinanong, drug of choice for hypercholesterolemia, answer your statins. So, cholesterol. Paano naman kung resins? Ang resins natin, your choles. Usable acid resins, kailangan tandaan your adverse effects, your steatorrhea, malabsorption. For your ezetimibe, or your NPC1L1 transporter inhibitor, liver. Okay? Liver toxicity. Your statins can also cause liver and muscle toxicity. Remember that. Okay? Statins, liver and muscle. Your sitosterol is a cholesterol analog. Your niacin, okay, natanong din to. Increases HDL. So pag tinanong sa boards, anong bibigay sa may low HDL? Answer, niacin. Okay? Your niacin. So, ang common side effect ng niacin is flushing, wherein you should give what treatment? Your flushing. Again, for niacin causing flushing, you give your aspirin. Okay, aspirin for the flushing caused by niacin. Then lastly, your fibrates activate your PPAR alpha. PPAR alpha. So it is a drug of choice for hypertriglyceridemia. Recap: pag cholesterol mataas, gamot, statin. Pag HDL mababa, gamot, niacin. Pag triglycerides ay mataas, gamot, fibrates. Okay? So remember these basic concepts. So let's move to the drugs acting in smooth muscles. Gusto ko lang emphasize here. So your buspirone, so mnemonic tayo, no? Buspirone, on, parang 1. So 1A, buspirone, partial agonist. Ito, triptan, ako palatandaan ko dito, yung one direction, so 1D, tuka-trip, tapos nagka-migraine sa trip. So one direction, nagka-migraine sa trip, so sumatriptan is a drug of choice for migraine. And in terms of mechanism, serotonin 1D agonist. Okay, sumatriptan, trip, yung one direction daw. So 1D. Then yung serotonin 2A, your ergot compounds, mnemonic, ergo-tumin. Then serotonin 3, tron. So tron 3. Cetrons. Okay, use ng cetrons, your chemotherapy-induced nausea and vomiting. Again, ito migraine. Ito chemo-induced nausea and vomiting. Then lastly, palatandaan ko dito, so sa dulo na, tingnan nyo. So yung nasa dulo, tagasunod. Okay, so tagaserod, tagasunod. Okay, so siya yung serotonin 4, siya yung sa dulo. Okay, so your prostaglandins, ito na-discuss na natin earlier, hindi ko na-expound now. Okay, so these are discussed in your quizmaster. So drugs for cough, ito natatanong din sa boards. In terms of mechanism, pag may cysteine, sa biochem, no, cysteine has a thiol. Your thiol has an SH, sulfur with hydrogen. Your SH would break the disulfide bridges na nagfo-form or nagpapakapal ng plema. Okay, that's why it's called mucolytic. It lyses the mucus. Your guaifenesin irritates your gastric vagal receptors, expectorating the phlegm. Your opioids are centrally acting, diba? They're antitussive, so pang dry cough. So mechanism, decrease sensitivity of CNS cough center, si butamirate, centrally acting pa din sa brain stem receptor. Si levodopa naman, peripherally acting. So memorize nyo to kasi siya lang yung peripherally acting na antitussive. And then last year, Lagundi is mainly a bronchodilator. Meron din anti-inflammatory properties to, but mainly it's a bronchodilator. So remember these mechanisms of action. Again, we try to simplify it, no? Pero tinatanong yan sa boards talaga. So, ito, your ketotifen was as in the one of the recent boards. So it acts as a non-competitive antihistamine and mast cell stabilizer. Okay, so remember that. So antihistamine na siya, mast cell stabilizer pa siya. Sino yung makilala ng mast cell stabilizer? Your cromolyn. So nedocromyl tsaka cromolyn. Okay, those are your mast cell stabilizers. So briefly, let's discuss your CNS drugs. So mnemonic natin dito for barbiturates para malaman niyo yung duration of action. So may TH, no? Thiopentol, methoxytal, ultra short. Then yung long acting, yung may PH. So pilit, pero madali siyang tandaan. So PH. Tapos Primadonna, kaya matagal mag-ready. So si Primidone, long acting.
Doc Mads.
And also, coach told them to take off their earrings when they.
Sorry guys, wait lang natin si Doc Mads. Parang na-disconnect siya. Do you guys want to take a 3-minute break? Let's take a 5-minute break. Alright. So, tapos na yung 5-minute break. Doc Mads is already here. Co-host lang, Doc Troy.
Done po.
Thank you. Doc
Thank
Mads,
you.
you can start na ulit. Thank you.
So, nag-change device na lang ako. I think my mic connection. So, I so, let's continue. So, can you guys hear me?
Yes, Doc, we can see it.
Thanks. So let's continue, no? So for this one, you have to remember, so we talked about your barbiturates, no? So yung natin. For this one, ako nung dito, ito succinide. So sucs, so para siyang socks. So socks milk. So mechanism of action na is sa calcium channel. So that's your ethosuximide. How about clomazepine and phenytoin? So ito, inisip ko, these are the anti-seizure meds acting on sodium channels, yung tatlo. So if you want a crazy, corny mnemonic to, ba't ka nanginginig? So seizures, naka-bili, ano ba, ng coffee. So naka-bili, so your sodium channels, valproate, your carbamazepine, and your phenytoin. Okay? Or tandaan nyo na lang yung tatlo. And one more thing about valproate na gusto ko i-emphasize, your valproate is one of the anticonvulsants na CYP450 inhibitor. Okay? Kasi most of these, like your carbamazepine, your phenytoin, and your phenobarbital, these are all CYP450 inducers. Okay? So please guys, wag niyong kakalimutan. Valproate is an inhibitor. Okay. So ito, no? Kita-kita na yung natakpan. So, all local anesthetics are vasodilators except your cocaine. The most cardiotoxic of all local anesthetics is your bupivacaine. Associated with methemoglobinemia is your benzocaine or your prilocaine. And the antiarrhythmic used for digitalis toxicity is your lidocaine. So ito, please remember nyo to. Again, this is summary lecture. This is not all about local anesthetics, but I hope it makes you remember. Okay? So, okay, again, constrictor, cicocaine, constrictor. The rest, dilator. Most cardiotoxic, bupivacaine, methemoglobinemia, benzocaine, and prilocaine. And antiarrhythmic for digitalis toxicity is your lidocaine. Okay? Again, kung titignan nyo kanina, no, your lidocaine is what class of antiarrhythmic? Class 1. Ano kaya? Nalala nyo ba? So, double quarter powder, penging, lettuce. So, lidocaine is your lettuce. Class 1B. As a class 1, ano po? Anong mechanism? Nabakla ka. So nabakla ka. So, sodium. So this one naman, so for your antipsychotics, you have your typical or classical versus your atypical. So your typical antipsychotics, kaya siya typical kasi ito addresses your positive symptoms like your hallucination. It blocks more of your D2, kaya siya typical. Kasi bakit? Nung na-invento yung atypical antipsychotics, mas nag-target ka na ng serotonin 2A receptors, therefore also addressing your negative symptoms. Okay, remember this. In terms of potency, pag high potency, high, haloperidol. Pag low potency, your thioridazine and your chlorpromazine. So remember this. So guys, yung sinasabi ko, prototypes na, hindi lang ito yung drugs. So again, I'm just summarizing. So you should still check your handouts for the complete list. Pero ito yung mga common na prototype na drugs na nababanggit. So, yun gusto ko tandaan niyo. Pag sabing high potency, ibig sabihin the higher D2 blockade. Higher D2 blockade. So therefore, anong sabi natin? Pag low dopamine, Parkinson's. Diba? Pag high dopamine, ano naman? Psychosis. So tandaan niyo yan. So therefore, if you're treating psychosis, you want to address this, diba? Bababaan mo si dopamine. Ano makukuha mong symptoms? Parkinson's-like, or it can manifest as your extrapyramidal symptoms. So therefore, the more you block D2 in your typical, the more EPS you have.
Okay, so high potency, more APS. How about your low potency? So your low potency, okay na, hindi masyadong dito blockade. Ang problem, may anti-ham effect. So remember nyo to. Anti-ham, meaning antihistamine, kaya inaantok, sedation. Alpha, so nangyari sa alpha blockade, baba ang BP, hypotension. Muscarinic blockade is magkakaroon ka ng anti-muscarinic. So, pwede magkakaroon ng ALS and Wonderland symptoms. Particularly dito, pwede magkaroon ng dry eyes or dry mouth. So, anti-muscarinic. How about your atypical naman? So, dahil typical, atypical naman, there's is both positive and negative symptoms. So, ito yung mga mas bago. You have your zapin with the highest weight gain. So, palatandaan, hindi kumain ng sapin-sapin. Kaya tumataba. So, weight gain. Your risperidone is the only antipsychotic approved for youth na may schizophrenia. So, only anti-schizophrenic drug for children. Also in Nelson. So, mas no. And the others are the following. Okay? So, ang important tandaan kapag atypical antipsychotics, metabolic yung adverse effect. Again, ulit-ulitin, pag high potency typical, EPS. Pag low potency atypical, ay low potency typical, anti-ham. Sorry, ang baboy ng drawing natin, no? Then kapag atypical, yes, metabolic. Okay, metabolic like weight gain and endocrine problems. So for your opioids naman, remember these, no? So gusto ko na lang i-emphasize, aside from these na nasa handouts nyo, are the opioid overdose trial. So CPR yung isang pwedeng mnemonic, diba? So pag na-overdose ng morphine, anong gagawin mo? Mag-CPR ka. So what's your CPR? Comatose, pupillary constriction, or meiosis, diba? And respiratory depression. So remember that. Mag-CPR. You triad of opioid overdose. So, mnemonic natin for lethal injection, no? Kung nakita nyo na to. So, papatayin kita. So, pancuronium, you have your pancuronium, your potassium chloride, and your thiopental. Ayun kita. Okay? So, yun mnemonic natin. So, ewan ko kung makakatulong siya sa inyo, pero it helped me. So, drugs for hema naman. So, gusto ko ng important emphasize, no? Prototype natin na antiplatelet, your aspirin, is a non-selective and irreversible COX inhibitor. So, hindi ma-reverse, hindi selective. Ito, abcimab, tirofiban, aptifibatep, diba? Na-emphasize na tinag-document sa inyo, yung mnemonic na may 2-3 pack abs yung mga taga-FIBA. Okay, may 2 to 3 pack abs yung mga taga-FIBA. So, 2-3 pack abs yung taga-FIBA. Then itong mga may cloth tsaka grill. So, tandaan nyo lang si clopidogrel. Lahat yan, ADP, inhibitor. Again, pag may cloth, like your ticlopidine, or may grill, like your prasugrel, ticagrelor, these are ADP inhibitors. Then pag PDE3 inhibitors ng antiplatelets, you have your silostazol and dipyridamole. Okay? So ito yung mnemonic ni Dr. Imran for that. Pwede mumatay sa silong mga 3 times daw. So PDE3, momol, dipyridamole, silong is silostazol. Okay? So anticoagulants, again, na-discuss natin kanina si warfarin. So ito naman mga saban. Ibaroksaban, apixaban, mga ganyan, may sa. Tapos ban, ibig sabihin mo. Ban is antagonize. Tapos XA. So mechanism, factor 10A inhibitor. Again, factor 10A inhibitor. So saban. Advantage, it is a rapid and shorter half-life than warfarin. How about your heparin? Ito ang drug of choice again for pregnant. Kung monitoring ng warfarin is din time, antidote, vitamin K, or fresh frozen plasma. Ano naman kay heparin? So sa kanya yung APTT, and ang antidote natin is your base na discuss natin. Then quickly, ito mga saccharin, parin. These are anti-thrombin 3 potentiator. Okay, so the advanced potentiator effect of anti-thrombin 3 as with your heparin. So these are your low molecular weight heparin. Difference, hindi mo monitor sa APTT. Then, ito naman. Ano yung antidote to the bigatran? That is your idarucizumab, diba? Idarucizumab. Okay? So, again, memorize nyo itong mga antidotes. Okay? What else na memorize? Mga indications na unique. So, again, high molecular heparin for your pregnant patients. So, dun na tayo sa other drugs and kids, DMARDs. So, since short na tayo sa time, ma-emphasize ko lang, first choice nyo for rheumatoid arthritis is your DMARD na methotrexate. Again, na-discuss kanina, so ulit-ulit tayo kasi important. Polinic or lucoparin yung antidote. Okay, so the others you memorize, but I want to share this mnemonic, no? So, I'm thankful. So, tiyan nyo. To Sir Ethan. So, si Ethan Hawke, di ba? Yung sa picture. May limona, may Netflix pa. Okay, so remember this mnemonic. Meaning, TNF alpha inhibitors, Sir Ethan. May limona, may Netflix pa. So, yung isa is in fixing. Okay? So, siguro corny na kayo. Okay lang guys, ilang minutes na lang. So, I'm thankful to Sir Ethan, may limona, may Netflix pa. These are your TNF alpha inhibitors. Must know. Okay, other drugs, monoclonal antibodies. So, paano mo na-memorize? Pinumab, Ventin, Siliximab. 2 ulit, so B. Second letter. Uste. So, I think pinamalik ng Doc Eman here is parang yung paskuhan daw ng uste sa December, no? 23. So, mas maganda yata yun kasi yung akin ng corny, parang 1, 2, 2, 3, go! Uste. So, ganun yung mnemonic ko for this. Parang yung cheer. Asa tomasyan, no? So, 1, 2, 2, 3, or pwede rin, yan, maganda rin yung December 23 or 12, 23. So, basta tandaan nyo, target na interleukins. So, ito, tandaan nyo, these are the drugs affecting microtubules. Pero aside from knowing that, pakita ko na lang yung mnemonic, no? Para mas madali nyo matandaan. So, maliit ang tubo if mag-grab to Cavite. So, ano yung drugs acting on your microtubules? So, para madaling tandaan, microtubules, maliit ang tubo. So, nga naman. So, isipin mo, galing ka kunyari ng Manila, kung mag-grab ka ng Cavite, di ang mahal nun. Tapos, may tindahan dala. So, tubo maliit. So, maliit ang tubo if mag-grab to Cavite. So, Primebendazole, thiabendazole, these are anti-helminthics, diba kanina? Busulfan, antifungal. Colchicine, so for gout, no? Albendazole, also antifungal. Then, your Vinca and Taxane are chemo. So, tignan nyo. Antifungal. Okay, so these 3 are antifungal. These 4 are antifungals. These 2 are antihelminthics. This is an antifungal. And this are antihelminthics. What I mean is these 4 are antibiotics. Okay? Then your colchicine is for gout. Then your Vinca and Taxane are chemo drugs. Okay, so endocrine na tayo. More important na. So yung drugs with amino acids in their name, yung mnemonic ko dyan, lysine and choline, aspartate, glutamic and lysine, these are rapid-acting insulin. So mabilis, may amino acid, basic drugs lang. Then your regular is the short-acting. Ito, memorize ko na lang sa NPH at lentier intermediate. Then ito, ultra, large, dati pa. So dati. Then glute, these are long-acting. Okay, so tandaan niyo yung mga mnemonic. Ultra, large, dati, glute. So glute, di ba parang nakadikit? These are long-acting insulins. So ito, na-discuss na natin earlier. So drugs for diabetes. So this one, I won't discuss na, no? Basta remember niyo, mas important itong side effects. Okay, now we proceed to your antibiotics. So gusto ko lang emphasize yung most common side effects. So for your penicillin, whatever the penicillin, sasagot nyo, hypersensitivity and GI upset. Again, hypersensitivity and your GI upset. Again, hypersensitivity and GI upset. Yung disulfiram reaction, na-discuss ko na kanina, no? I met a man who procured and fought for money and died soon, di ba? And then ito, I want to emphasize, so star na to sa notes. Pag sinabing methicillin, na-discontinue to dahil it can cause your interstitial nephritis. Again, your interstitial nephritis. And then your nafcillin, letter N, neutropenia. Ito, na-discuss na rin natin your ampicillin clindamycin causing your pseudomembranous colitis. Then your Redman syndrome it can be caused by your vancomycin pneumonic. Ang palatandaan ko dito, dala-dala yung red van. So, vancomycin acts on your D-ala, doon siya nagbabind. So, dala-dala yung red van. Then your, again, gray baby, di ba? Alam niyo na yun, aplastic anemia. So, sa chloramphenicol. For QT prolongation, marami, including your quinolones and macrolides. Then lastly, your quinapristine, dalfopristin, tinandaan ko pareho silang magkadikit. So, quinapristine, tapos dalfopristin, this is governing, causes magkadikit din. Arthralgia tsaka myalgia. Okay, so na-discuss na natin itong pneumonia. Doc, I think pala we have less than 10 minutes. So if ever mag-protocol ko, Doc, si Doc Yali.
Okay lang.
Anyway, so this one we discussed earlier. Thank you, Doc. So, okay, so ito. Gusto ko emphasize, drug of choice for sexually transmitted infections. So kahit anong ano yan, kahit anong subject, basta micro or STI, tatanungin yan sa boards. Again, tatanungin yan sa boards. So pwede sa IM, OB, pedia, not naman siguro pedia, pero micro, pharma, they usually ask for sexually transmitted infection. So drug of choice for syphilis is your penicillin G, for gonorrhea, ceftriaxone, chlamydia, doxy or azithral, candidiasis, your mistopin, and your azoles. In your backbat, your bacterial vaginosis, your metronidazole. So please know this by heart. Again, know this by heart. Cephalosporins of choice. Pag Pseudomonas, you choose these three. Kung pipili ng isa, si ceftazidime. Pag Neisseria, again, gonorrhea yun, kanina, ceftriaxone. MRSA na cephalosporin, your ceftaroline, or sa ibang reference, it is your 5th gen cephalosporin. Pag pneumonia or strep pneumonia, ceftriaxone and cefotaxime. And then, anong ginagamit nyo sa ward? Di ba pre-op, your cefazoline, this is your 1st gen. Ginagamit siya as prophylaxis, di ba? Pre-op prophylaxis. Drugs for HIV, so emphasize ko lang yung mnemonics. Paano tandaan do? Pag may veer sa gitna, ano siya? Yung dalawang N, may N din sa gitna. So, NNRTIs, may veer sa gitna. Next, your protease inhibitors. So, tandaan ko dito, PI na virgin. So, PI na virgin. So, protease inhibitors, na veer. Your fusion inhibitors, flubertine. So, magsi-CR daw si Mara. So, CCR5. Then, Tegra. So, integrase, dolutegravir, daltegravir. Okay, these are drugs for HIV. Okay, so ito, mnemonic to since ng pharma kami, no, yung Wager-Pens, paano siya ina-analyze. So, sulat nyo lang, kapag sa boards, Wager-Pens. West, Gabiansa. East, Rhodesiense. Tapos tandaan nyo, yung gitna, CNS phase, gilid blood phase. Then, mahirap kasi yung names ng gamot, diba? Kasi hindi siya common. So, tandaan nyo na lang yung Wager-Pens. So, pag West African is caused by Gambiense, so that the drugs could either be pentamidine for your blood phase, eflornithine for your CNS phase. Pag East African sleeping sickness, melarsoprol for your CNS phase, suramine for your blood phase. Okay? Basta tandaan niyo yung mnemonic na Wager-Pens. Until matrix of choice, I discussed earlier. And then lastly, second to the last, diniscuss na rin natin kanina, no? During your Quizmasters, yung mechanisms on the cell cycle. Okay. So, ito, start tayo dito. Kung magtatanong ng isang drug sa chemo, kung hindi mechanism, I feel like adverse effect siya. In the recent trend sa boards talaga, adverse effect. So, tandaan mo, platins, nephrotoxic. Okay? So, drawing nyo na lang to. So, cisplatin, vincristine, ito yung V, peripheral neuropathy. Doxorubicin, heart. So, cardiotoxic, bleomycin B. B for baga. Or drawing niyo yan. So, bleomycin. Then cyclophosphamide, CY. Hemorrhagic cystitis. Then ito, lahat to, di ba, itong B, vincristine pa rin, Ervinca. Then itong 56 tapos may M, these are your drugs causing myelo suppression. Okay, so remember the key naman. Again, the rescue agents discussed earlier. Mechanisms of actions. Now for GI drugs, so gusto ko lang tandaan yung laxatives na mechanisms. So commonly, ina-ask yung naka-red. Okay, so remember that. Balikan nyo na lang. And then for your toxicology, just remember the antidotes. So what I want to emphasize lang dun sa tables na meron din kayo sa handouts are the following. So for your benzodiazepine toxicity, we use your aze. Benzodiazepine, fluazepine. For again, omeprazole na discuss natin, alcohol dehydrogenase inhibitor. So alcohol toxicity, methanol, ethylene glycol, and ethanol. The naloxone, again, is an opioid antagonist, so opioid poisoning. Pyridoxine, again, for your organophosphate toxicity. Mechanism ulit to, acetylcholinesterase regenerators. So, kung napapansin nyo sa antidote, ang dami na natin discuss kanina, di ba? Kasi it's a commonly asked question in the boards. And aside from antidotes, of course, remember the adverse effects. So, yun ang pre-sentence. So, that's it for your short summary lecture, no? So, I did make it 1 hour. Hopefully, you learned a lot. Again, summary lecture, so it's not all that we should know, but it's the must-knows, and I tried to help you with the mnemonics I can give. Okay, so thank you, doctors. Do you have any questions?
Thank you so much, Doc Mads. Thank you, thank you. Yes, Doc, merong a few questions, parang points of clarification lang yata ng mga tao. So, wait lang ah. After nito pala, the question and answer, meron tayong clarifications dun sa handouts, mga corrections sa pharma handouts. Okay? So, first question, in our lecture and handout, it states that pralidoxim must be administered before 6 to 8 hours before aging of the organophosphate bond. But in the practice test, pharma practice test question number 1, it states naman po na 24 to 48 hours yung time frame for aging of the covalent bonding. May we know po kung ano yung source na fina-follow for this? Parang toxic yung tanong, source na fina-follow. Pwede
Opo,
naman,
for this
sige.
anong practice, but maybe I can check that sa Katsung kung ano yung stated. Pero if you had to follow one, either Katsung or Goodman and Gilman ito. But I feel like hindi po, based sa trends po sa pharma, they don't really ask particularly sa numbers. Parang hindi naman po sila very specific. So I think mas important to know that it regenerates acetylcholine and it is acetylcholinesterase and that it is given early sa toxicity rather than knowing kung 6 to 8 versus 24 to 48. Yan. We're not sure din sa, kasi kung ano reference nung gumawa ng handout versus nung practice test.
Tapos meron pang question. Ang sabi is, yung about sa DM drugs that does not cause weight loss, we were taught in our IM rotation that in the new guidelines set by the ADA, this 2023 daw po, metformin is considered to be weight neutral na daw po. If they gave us po this, for example, yung question na yon, I was hoping to ask lang po sana if what should be followed for in the boards.
A really good question. Actually, Doc, nung nag-review din ako before, ever since in pharmacology or in Katzong, it's weight loss. Pero if it's siguro as an IM, maybe it could be weight neutral. Maybe that's our, ano na lang siguro, game plan. Pero it's also been taught kasi, even in the prior journals talaga, na metformin caused weight loss. So, pero siguro in the more recent guidelines for diabetes, I agree, it was stated that it's also weight neutral. But still in pharmacology, we're leaning more towards weight loss pa rin if we had to choose. Kasi feeling ko the examiners would still, if they ask that, I think it would still be appropriate to answer weight loss in pharmacology. That if it's an internal medicine, weight neutral. For me
Actually,
po,
Doc, even in other subjects, may mga points of clarification na ganito, lalo na pagbago yung guidelines. Especially nga like sa IM, ganyan sa pedia. So, yun, hindi mo talaga maiisip kung ano yung naiisip ng Board of Medicine. Meron pa bang may questions from the batch dito sa mga nasa Zoom? Wala na? Wala masyadong questions sa pharma. Clear na clear sa kanila. Alright, so if clear na clear sa inyo mga BBs, thank you so much Doc Mads for
thank you
this.
so much din, Doc. Sorry, naka-off na yung video ko, Doc.
Thank
Kasi
you. No problem, Doc. Ayan, so now I'm gonna call on our next speaker for clarifications lang naman. Ayan. So our next speaker is Dr. Manuel S. Vidal Jr., a registered chemist to, diba, Doc? MD, PhD, BS in Biochemistry sa DLSU Manila, rank 2 sa Chemistry Licensure Exams noong 2014. He got his MD from the University of the Philippines, Manila, PhD in Molecular Medicine, University of the Philippines, College of Medicine, and now he is in Galveston, Texas for his predoctoral research fellowship. Hi, Doc. Good evening.
Hello. Hi, good evening, everyone. Good morning from here. I'll share my slides lang po.
Sige, Doc, go.
Nakashare na ba yung slides ko, Doc Lalo?
Hindi pa, Doc.
Yes. Hello.
Yan, okay na.
Hi, everyone. So, this is Manuel. So, we will be just addressing some of the corrections for the handout. First off, we released earlier an addendum handout. So this contains additional notes for some of the content not previously included in the main handout. So most of the slides that were discussed in central nervous system pharmacology, in endocrinology and hematology, we have included them in this handout. So please refer to this handout just in case you have other questions in the slides in the videos, because some of the content were not there. The first correction for the handout would be the response curve. So we have two response curves in the handout. It's the graded dose response curve and the quantal dose response curve. So the quantal dose was not included in the main handout. So it's the minimum dose required to produce a specified response in each member of a population. And the quantal dose response curve, it's the graph of a dose versus the fraction of the population that responds at each dose. So we can derive the median effective dose from here, ED50, which is the dose at which 50% of the population responds. And this can also be used to graph toxic or lethal effects of the drugs. So we can also derive the median toxic dose and the median lethal dose from this curve. So please screenshot or take down notes from this slide, but we will be reusing them also. Next would be, what else can cause a non-competitive inhibition? So I think that there was a question in one of the bullet points in the right lower quadrant. And so some of the examples of your non-competitive inhibition can be your phenoxybenzamine, which is an irreversible alpha antagonist, and maraviroc. So it's an allosteric antagonist that targets your receptors in CD4 cells. So these are some of the examples, but you can have other drugs as well for non-competitive inhibition. For the section synthesis on drugs for hypertension, I think there was in the section synthesis there were two rows there saying that one would be a ganglion blocker, and the next one would be a post neuron ganglion blocker. So anatomically, we don't have a post ganglion site in the neuromuscular site because that would refer to uh, either muscarinic or nicotinic receptors already. So please just disregard the postganglionic neuron blocker row. Next, for page 30, we have entacapone versus tolcapone. So this was a correction regarding the mechanism of action of entacapone. So it inhibits only the periphery, not centrally. So it's in page 30. Next would be the use of xanthine oxidase inhibitors. So in page 45, there's a table there. It's saying some notes for allopurinol and febuxostat administration. So we do not start instead of withholding, okay? Because if the patient is already on urate lowering therapy, then the co-administration of drugs that will used for acute attacks can be given. No? But if not previously on urate therapy, then do not start until after the gouty attacks. So please make that correction for both allopurinol and febuxostat. Iodine and iodide in page 47, right lower quadrant. The headings were just interchanged, so please make that note. Next would be for toxicities of aminoglycosides in page 59. In your previous version, the most vestibulotoxic drug would be tobramycin, but in Katzong, I think the Dr. Rodriguez says that streptomycin is the correct one instead of tobramycin. So please correct that also. In the CNS video, the timestamp would be 245. Some of the opioid side effects would include meiosis, constipation, and convulsions in the previous version. So please correct this one. It should be analgesia. So they all exhibit little to no tolerance development with chronic opioid use. So those are all the corrections that we have for our main handout. So we will be addressing corrections and we'll be updating the handouts accordingly as you guys study for the boards.
Thank you so much, Mavi. I apologize to everyone at ngayon lang nakabalik. So sabi ko, mag-take over muna si Mavi to discuss. Mavi is your MD PhD, got his PhD just recently. Congratulations! Ang kilabot ng Texas. Ano pa ba? So far for the practice 1 and 2 ng pharma, no corrections were noted for practice test 1 ng pharma. For practice test 2 may isa. Okay, so i-compile na lang natin din yan. Okay, at i-release. Kani-kanina lang, actually immediately before the discussion nakita. Okay, so maraming salamat Doc Mavi, maraming salamat Mads. Back to you, Lala.
Thank you.
All right, thank you so much for joining us, Doc Mavi. And thank you so much, guys, for joining us. And here is our video na gusto lang namin i-share sa inyong lahat. Happy Aral, everyone!
Good night, everyone. So this ends our session for tonight. See you all tomorrow for the intro to surgery. Okay? The surgery lecture videos are already available for those who want to study in advance. Para lang hindi ma-overwhelm bukas. Tapos na kayo sa pharma, ready na ang surgery.
Eto na naman tayo bagong simula. Huminga ng malalim, alisin ang kaba. Tapos na ang kahapon, pwede na yan itapon. Wag lang ang mga aral, dapat yan ay ibaw. Katulong mo sa panibagong hamon. May paparating na bagong araw, pwede kang lamunin o pwede mong sabayan. Aral ang kahapon, pwede kanyang gabayan.
Kung ako sa'yo, tumayo ka na dyan, huwag ka na magpahuli. Kami ay sundan patungo sa liwanag, abutin ng tala. Pagkatapos pagkita sa mundo, pusong nagbabaga.
Upang lahat ay mamulat sa aking susulat, parinig sa lahat ang aking ulat. Huwag kang mabahala, ang Diyos na ang bahala.
Walang imposible, sige lang sige. Abot mo ang mundo, malapit malayo, sama-sama tayo hanggang sa dulo. Ano man ang pagsubok, di susuko. Alam kong kaya mo, sige lang sige, sige lang sige. Walang imposible, walang imposible.
Nagdidingding ang pangarap ng iyong pusong humihiling. Nakalimutan ang kahapon, sana'y dinggin. Sigaw ng aking puso, hindi susuko, hindi susuko.
Ilabas ang iyong pangarap, huwag mo yang itatago. Samahan mo ng sipag at tatag ng puso. Tumayo ka sa iyong silya, ikaw ngayon ang ida. Wala nang pipigil pa, eto na, eto na.
Walang imposible, sige lang sige. Abot mo ang mundo, malapit malayo, sama-sama tayo hanggang sa dulo. Ano man ang pagsubok, di susuko. Alam kong kaya mo, sige lang sige, sige lang sige. Walang imposible.
Napapagod, naiinip, natatawa, nagtataka, naiinggit, nagagalit, nangangawit, nabibigla, nalulungkot, nabubugnot, nahihiya, natutukso, nakukonsensya, nauubusan din ang pasensya, nasasaktan, nagmumura, pero lumalaban pa rin dahil natuto na.
Hanggat ako'y humihinga, sugod ng laban pa. Pangarap pabuting, kumislap tulad ng mga bituin. Sige lang, di ka nag-iisa. Sige lang, sige pa.
Walang imposible, sige lang sige. Abot mo ang mundo, malapit malayo, sama-sama tayo hanggang sa dulo. Ano man ang pagsubok, di susuko. Alam kong kaya mo, sige lang sige, sige lang sige. Walang imposible, sige lang sige. Abot mo ang mundo, malapit malayo, sama-sama tayo hanggang sa dulo. Ano man ang pagsubok, di susuko. Alam kong kaya mo, sige lang sige, sige lang sige. Walang imposible, walang imposible.
Kung kaya ko, kaya mo. Sige lang, sige. Eto na naman tayo bagong simula.
Thank you everyone for joining us. Good night.